privilege to welcome all of you for the head injury awareness program. The theme collective care, building hope and recovery. For this awareness program, I have the honor to invite the chief guest of the function, Dr. G. Gururaj, Chairman Health Vision Group, Government of Karnataka, and our former Director and Senior Professor of Epidemiology, NIMHANS, as a chief guest for today's function. I welcome you, sir. I have the great privilege to welcome our beloved Director, Dr. Pratima Murthy, Senior Professor of Psychiatry, and our beloved Director of NIMHANS. I welcome you, Madam, for the program. I am extremely privileged to welcome Dr. B. Indira Devi, our Senior Professor of Neurosurgery, and our Dean of Neurosciences, and our Controller of Examinations. I welcome you, Madam. I have the great privilege to welcome Dr. B.S. Shankar Narayan Rao, our Registrar of NIMHANS, for the function. I am extremely happy to welcome all the faculty members of NIMHANS, Dr. K. Muralidharan, Medical Superintendent of NIMHANS, for all the support, and welcome you, sir. I welcome Dr. T.R. Kanmani, the coordinator of this program and a consultant in the Department of Neurosurgery. I welcome Dr. Kanmani. I welcome all the HODs of various departments, all the senior faculty members of NIMHANS. I also have the privilege to welcome Dr. L. Sobini Rao, our Professor of Clinical Psychology and former Head of the Department of Clinical Psychology. I welcome you, Madam. It's a great privilege to have you. We are extremely thankful to welcome you, Madam. I also have the honor to welcome all the members, Dr. Uma from the Department of Clinical Psychology, Mr. Sheshnath, a member who is one among the stakeholders, and I have the privilege to welcome Mr. Sheshnath. Welcome you, sir. Dr. Bhatri Narayan, our beloved NABH coordinator and former our medical superintendent of NIMHANS. I welcome you, sir. I have the privilege to welcome all the members of my own department, very especially Dr. B.P. Nirmala, Dr. Janardana, and all the faculty members of various departments, Department of Public Health and Epidemiology, and many other members, all my PhD scholars, all the PSWs, all the MPhil scholars, and there are many other social work trainees. They have come from all over the country. In fact, there are 29 people who have come from Ambedkar College of Arts and Science from Chennai. I am extremely happy to welcome all of them. I also have the privilege to welcome Garden City University, College of Nursing, and the entire staff and students of NIMHANS for this awareness program on head injury. I welcome once again all of you.
Thank you very much, sir. While Head Injury Awareness Day observed every year on 20th March aims to provide awareness and educate the general public about traumatic head injuries, the 2021 to 2023 campaign theme is More Than My Brain Injury. With this, Department of Psychiatric Social Work NIMHANS is organizing the awareness program with the theme Collective Care, Building Hope and Recovery. Now, I would like to invite Dr. T.R. Kanmani, Associate Professor, Department of Psychiatric Social Work, the program's organizer, to introduce the program's theme.
Good afternoon to everyone. I welcome Dr. Dhaval Shukla, sir, who has been a support throughout my journey at NIMHANS. And this program, basically we have started because we have seen multiple patients, whoever has been coming and accessing services with us, and also getting care and other facilities with us. We have found they also need a different kind of an education awareness program. So based on that, we have started this program. I will do a small introduction about this. Being a psychiatric social worker, I feel it's needless to emphasize that in the medical multidisciplinary team division of the labor is the core principle and philosophy to adhere in letter and spirit in facilitating collective responsibilities to address the goal for clinical restoration and recovery, which is extremely important component. The case management services, which is being promoted and recognized all over the world, has got qualitative inputs on the clients and their families' overall well-being. With that, the division of labor, the case management services are the deciding factors for better prognosis and quality of life of the clients with head injury. So with this, we start our today's program. Thank you.
Thank you, ma'am, for introducing the theme. Finance is an essential part without which developing the IEC materials is not possible. I take this opportunity to thank our MS, Dr. K. Muralidharan, Resident Medical Officer, Dr. Shashisaran, AOH and staff for helping us to publish today's IEC materials with the funding from Swachhata Action Plan, Kai Kalpa, and intramural funding. Dr. K. Muralidharan is working intensively in the area of bipolar disorder and has contributed to using biomarkers for clinical staging of bipolar disorders. May I now take the pleasure to invite Dr. K. Muralidharan, Professor of Psychiatry and Medical Superintendent, NIMHANS, to address the gathering.
A very good afternoon to all. And let me at the outset thank Dr. Pandey and Dr. Kanmani and team for inviting me for this World Head Injury Awareness Program. It is indeed an honor for me to be here and share the dais with so many stalwarts who have worked in the area of head injury and head injury awareness. Particularly honored to be sharing the dais with Dr. Gururaj and Dr. Indra Devi. We have Professor Dhaval and Dr. Shobini, who've done a lot of work in the area of head injury and traumatic brain injury. So while I'm sure you'll be listening to a lot of perspectives from different people about the medical aspects of head injury, the psychological aspects of head injury, the psychosocial aspects, the need for long-term care and rehabilitation, I thought I will just raise a couple of points from the perspective of a hospital administrator so that you can understand the kind of damage that head injury can do and why it is important to prevent it. So in the month of February 2022, about 2,340 patients have availed emergency services in our casualty, of which at least 25% are patients with head injury. Now you do the mathematics. How many patients with head injury did we see? Some answers. Sorry? Around 450 to 500. So that's the number of patients with head injury that we see at NIMHANS in a month. In the month of March 2022, till date, about 400 patients with head injury have come to our hospital seeking treatment. Now, how does the hospital provide treatment for so many patients with head injury? Let's say that even 20% of these patients, if they require ventilator beds, then you can see that there is a great mismatch between the availability of resources and the treatment that the hospital has to offer. Which is why it's very important when I see a lot of young people in this room, it's important for me to share this message that the best way to prevent, the best way to make sure that head injury is not a serious issue is to prevent it. Please follow all precautions that you can. Of course, I'm talking mostly about road traffic accidents, but there are other ways in which head injuries can happen. I'm not saying no. But the most preventable cause of head injury is road traffic accidents, so please stay safe. Remember that the infrastructure that is available in the country for treating head injury for acute care is very, very limited. In addition, it's not only about the acute care, it's about the post-head injury sequelae and the rehabilitation that is required that is also quite grossly inadequate for the number of patients that we see. So the most important thing for us is prevention, prevention, and prevention. So with these few words, I'd like to say thank you for the opportunity and good luck to the organizers of the program.
Thank you so much, sir, for sharing how this program is important in the hospital administrative perspective. The Department of Neurosurgery, NIMHANS, was established in 1958, and in 1978, a post-trauma clinic was started to cater the need of head injury patients with a multidisciplinary team approach. Dr. B. Indra Devi has served 3 decades in the management of trauma care and is extensively working for patients with traumatic brain injury from acute care till rehabilitation. I would now request Dr. B. Indra Devi, Dean of Neurosciences and Senior Professor of the Department of Neurosurgery, to deliver the special address for the program.
Good evening, all of you. Even as India has made great strides in controlling various infectious diseases, we have become popularly known as the traumatic brain injury capital of the world, which is of a matter of concern. And while various factors come into play for giving us this kind of a title, some of the things we can do at various levels, right from prevention to management to rehabilitation. I think a lot of things can be achieved in a small way, in a big way. Many of the smaller hospitals, they just wave off things saying that we do not treat head injuries. All these happen because they are quite scared of the medical legal aspects and also the costs which they heap up on the patient. But the pre-hospital management, which doesn't cost much and which can actually prevent secondary brain injury, it can be managed at various levels, right from the place of accident to the smaller hospitals which are the nearest to the place of accident before being transported to a major hospital. Actually, though the triaging is extremely important in not overcrowding the tertiary hospitals, so that the actual care of a severely head-injured patient, which can occur at these middle and tertiary level hospitals, can go on uninterrupted, should also be done. The problem with the trauma and especially the head injury is the amount of disability it confers. Okay, the disability may be discernible or it may be picked up only later. It may, and apart from the morbidity and disability, the other matter of concern of a traumatic brain injury is the mortality. And the problem with the tertiary hospitals or middle hospitals or any hospital as such, as Dr. Muralidharan was saying, that no hospital can keep a patient forever and then take care of the rehabilitation part of the program. Rehabilitation involves both social and also physical rehabilitation. From coma to the community, that should be the logical end of management of traumatic brain injury. Then for this, we need the support of the social workers. We need the support of the caregivers. Caregivers are usually the family members. And then we of course need a structured rehabilitation program. In India, to a large extent, some of these primary things, that is pre-hospital to triaging to actual surgical management of the surgical or medical management of the patients have been taken care. But we are lagging behind in the rehabilitation programs. The importance of rehabilitation program is that it will give you the long-term follow-up of a managed patient. So what happens is then the governments can make the plans accordingly, plans and then budgets accordingly. Unless you have long-term follow-ups, you cannot just say that this is better or that is better way of managing a patient, or we need more of hospitals, more of this, more of that. The traumatic brain injury management guidelines have been in place for many years. The World Federation has taken care of that, but majority of these are applicable to high-income countries, and they are not structured for low-income, low-middle income, or high-density countries. Dr. Franco Cervede, who is the immediate past president of World Federation of Neurological Surgery Societies, he has always said that the majority of the so-called papers and the guidelines come from countries which see less of the head injuries, whereas the maximum number of head injuries are happening elsewhere, and especially India as of now. So the Neurotrauma Society of India actually has looked into this, and then 4 of us from NIMHANS, Professor Gurraj, Dr. Dhaval Shukla, Dr. Malla Bhaskar also, and myself, we have participated in making the guidelines fit for a place like India or still lower income countries. This way, you cannot just say that we do not have this, we cannot do like that, we don't have ICUs, we do not have that. So this is something like logotherapy in psychiatry, madam. So you make do with what is available and try to do the best, and then try to get the best results. In the management of a traumatic brain injury patient, one of the most important parts which is neglected and usually not paid much attention to is the psychosocial aspect of the family as such. That is the caregivers. The caregivers also require care, and that important thing, that and the bond which they may develop during the hospital stay with the psychosocial team, that can translate into getting long-term follow-up of all these patients, so that you have the full data in place, so you can tell that managing this kind of a patient is likely to go and end up logically in this way, and then this kind of patients, if adequate care is given at the correct time, they can be totally reintegrated into the system. So there's the currently available guidelines for India are available in Neurotrauma Society website. I request all of you to read, and we are trying to disseminate it to many of the hospitals, because see, the pre-hospital care is very, very important. If that is not taken care of, and the triage doesn't happen properly, the mild head injury patients will land up in tertiary hospitals, and severely head injured patients will continue to remain in places where surgeons are not available, and surgical care might have been required. So, apart from that, I would like to tell that the rehabilitation of traumatic brain injury patient is extremely important. If you wanted to reintegrate, not integrate, reintegrate a patient from stage of coma onto the community and make a useful and effective recovery. With this, I would like to thank our neurotrauma services and our support team, all of them, both psychology and social work, and place on record that we are doing and we are striving to do much more. Thank you very much.
Thank you, ma'am, for highlighting the importance of pre-hospital care, acute trauma care, and structured rehabilitation of traumatic brain injury patients. The Department of Psychiatric Social Work has brought out various educative materials for the patients, caregivers, and for creating public awareness about traumatic brain injury. The IEC material release would not have been possible without the Chief Editor, Mr. Prabhudev and team, Mr. Benjamin Jacob, co-director of the video, the PRO, Mr. Chandan and the team, the Futura team, who helped us with various supports for this venture. We are happy to release 3 IEC materials prepared as part of the World Head Injury Awareness Program. I now request our chief guest on the dais, along with our Director, Registrar, Dean, MS, and Head of the Department, to release the IEC materials. First IEC material is an awareness video on collective care, building hope and recovery for traumatic brain injury patients and caregivers. It shows care and management provided for a traumatic brain injury patient and his family, which builds hope and leads to recovery. The next release is an informational manual on psychosocial interventions for women caregivers of persons with traumatic brain injury. This informational manual is a guide for the mental health professionals who provide psychosocial care for the women caregivers. The final IEC material release for the day is a brochure on psychosocial interventions for caregivers of persons with traumatic brain injury. We will now thank you all the esteemed guests for releasing the IEC materials. We will just now have a look on to our video IEC material. an e-poster competition on the theme Collective Care Building Hope and Recovery, and a story writing contest on the theme My Journey to Recovery in continuation of the World Head Injury Awareness Program was conducted. We received an overwhelming response from all over the country for both the competitions. The creativity in the art and information depicted in the posters were unique and appreciable. I would like to thank the evaluators for the competitions, Dr. Gautam MS from Department of Epidemiology, Dr. G. Radhakrishnan, Mrs. Lakshayani, Mrs. Shashikala from Department of Nursing, Dr. B.P. Nirmala and Dr. N. Janardana from Department of Psychiatric Social Work. Now, I would request our honorable chief guest for today to give away the prizes and certificates. Third prize for e-poster competition, Dr. Pushpa, Assistant Professor, Department of Physiology, Nandi Medical College and Research Institute, Chikballapur. Second prize, Dr. Tanvi Garg, second year psychiatric junior resident, All India Institute of Medical Sciences, Rishikesh. First prize for the e-poster competition, Mr. Jarpula Srinivas and team from Physiotherapy Department, NIMHANS. Story writing contest, third prize, Mr. Gerald Robinson, Savitada College of Occupational Therapy. He has not arrived today. Second prize, Mr. Anirudh, who is pursuing graphic and UI UX designing. First prize, Ms. Kumari Kashish, studying in 9th standard, Ryan International School, Bangalore. She also has not arrived today. There is a special mention for creativity in the poster. One is Mr. Anirudh. And Mr. Sadish Kumar, Project Technical Associate, Department of Psychosocial Support in Disaster Management, NIMHANS. We are giving Amazon e-vouchers as the prizes for the competition, which will be delivered through the email. Congratulations to all prize winners. Thank you, guys. I now request Mr. Anirudh, who has completed his graduation in Applied Arts from Karnataka Chitrakala Parishad, College of Fine Arts, and pursuing graphic and UI UX designing, a traumatic brain injury survivor, to share his lived experience.
So hello everyone. It's fine. At the outset, I wish to offer my sincere and heartfelt thanks to all the doctors and all the nurses, allied health professionals, and support staff here in NIMHANS for all the medical care given to me. I don't know how to express my gratitude to Dr. Indra Devi, who saved me from death and helped me recover, for all of you to see who I am right now today. I am Anirudh Seshnath, and I was a traumatic brain injury patient. I rode a pillion on a two-wheeler scooter, in the month of June in 2015, so almost 7 years now, and thought I was just, going on a scooter for a fun ride, but I ended up getting, so the right to hell. And if I am narrating my story today, it is because of the 7 years of immense the hard work, sustained effort, and giving my heart and soul to become who I am right now. After my head injury, the surgeries that followed, I initially could not remember even a word. Even words that I just spoke a few seconds ago, I couldn't remember. While I was on the wheelchair, I used to wonder when I'm going to get up and be able to at least walk a step ahead. For years, I used to get up in shock in the middle of the night with the memories of the traumatic pain that's coursing right through my whole body, and most importantly, in each and every cell in my human brain. But I kept on putting in the effort to get better and better, in spite of all the frustrations and the disappointments. Immediately after the accident, the thoughts that used to come to me were, why this happened to me? Who am I? What, wrong did I do for anybody? And it was in these seconds or moments, and sometimes it became years, that I came to realize that I have to believe in God even more, and He's the only one who can be with us. And He all has a plan, and that was the only reason this traumatic episode did happen, for some reason, which I learned and where I am today. Back then, I was in my 4th year of my engineering when the accident occurred. After 2 years of recuperation, I changed my career and to pursuit and joined the renowned Karnataka Chitrkala Parishad, the College of Fine Arts. I am proud to say that I recently completed the 4-year course of my bachelor's in visual arts, and I specialized in applied arts. I'm also taking other design courses, as ma'am said, into graphic design and UI UX designing, which will enable me to make a career in the designing field. One thing that I will always remember, it was told by C.S. Lewis, which says that hardship hardship often prepares an ordinary person for an extraordinary destiny. I intend to prove him right. I also bear in mind 3 words: never give up. I wish to thank Dr. Shivshankar. I wish to thank Dr. Shivshankar, the former head in speech pathology and hearing department of the institute, whose guidance and active support has helped me fully overcome my stammering and speak to all of you right here standing in the dais. I also wish to thank you and Dr. Chancellor Dr. Uma, Dr. Senthil, and the organizers of this event, along with others, for giving me the opportunity to share my experience with all of you right now today.
Thank you, Mr. Anuruddh, for sharing your lived experience. Dr. G. Gururaj, Our former director and senior professor in the Department of Epidemiology, NIMHANS, is currently holding a position chairman, Health Vision Group of Government of Karnataka. He has contributed to the WHO World Bank report on road traffic injury prevention, UNICEF report on child injuries, WHO guidelines for injury surveillance, and for the series of WHO good practice manuals on helmets, reducing drunk driving, and data manual. He has worked as an invited member of several national and international technical committees, including the WHO Leads Road Safety 10 project in India. May I now take the pleasure in inviting Dr. G. Gururaj, the chief guest of the day, to address the gathering.
Thank you very much and good afternoon. Namaskara. Professor Pratima Murthy, Director NIMHANS, Professor Indira, Dr. Shankar Narayan, Dr. Murali, Dr. Pandian, Dr. Shobini, Dr. Deval, many of my good friends at NIMHANS and friends. At the outset, I would like to thank you for giving me this opportunity to be here with all of you this afternoon as part of the head injury awareness program. This is a very important occasion for the Institute to launch series of new activities, new initiatives, as well as to bring focus on this important topic in the public. Brain injury is something which is very much talked about, but very little happens on the ground, especially in the rural parts of this country. It is something which is discussed, debated, and also given importance in more of academic and research platforms. But when it comes to taking care of a person at the grassroots level, we have very limited opportunities and scant resources. But at the same time, the problem is very huge. Just to put in perspective what is happening in just the city of Bangalore, every year about 2,500 people they die of an injury due to all causes. Road traffic injuries, falls, violence, fall from height, drowning, poisoning, disasters, many other type of things that can lead to a traumatic brain injury. And if we take that 60 to 70% of them will have a brain injury, that brings down this number to about roughly around 1,800 to 2,000 deaths just in the city of Bangalore. And for every death, our own research and international research has shown that at least 30 to 50 people get hospitalized because of a serious brain injury. So if you multiply 2,000 into 50, that is about 1 lakh people who get hospitalized or who are likely to get hospitalized just in a city like Bangalore in a year. And within this people who get hospitalized and who survive, among the traumatic brain injury patients, about 60% of them will have a mild brain injury, about 20% of them will have a moderate brain injury, and about 20% will have a serious brain injury, severe brain injury. And when they leave the hospital, 100% of severe, 50% of moderate, and 10 to 20% of these patients will leave the institution or the hospital with one or more disabilities that affects their different domains of life. And that number is a very, very huge number, even in a place like Bangalore. And if you look at the country as a whole, about 1 million people die every year in India due to different type of injuries. And these deaths are phenomenally more among young people in the 15 to 34 years. Productivity-wise, quite at a high proportion, who are the breadwinners of the family, who are at a stage in their life where they are trying to build their life and aspirations, who are trying to settle down with their family, who look forward to many greener things in their life. And unfortunately, brain injury hits people at this stage of their life, leading to very severe disastrous situations. It suddenly comes to my mind that when we were doing the study on traumatic brain injury registry at NIMHANS in 2003 to 2005, I visited an individual in Kanakpura, a KSRTC bus driver who had a brain injury, who was taken to the hospital but who could not be admitted because of different reasons. Ultimately, in his house, he was placed on a bus tire because by that time he had bed sores, he had urinary complications, he had other difficulties. Family was very poor. They could not afford treatment in a private hospital. This is 15 years back. And there was no governmental support. And ultimately, this person died after 2 months. The problems with brain injury are very severe. Unfortunately, in this country, because there is very limited research that is done, we don't have good understanding of what happens after brain injury. NIMHANS in that way led this activity in the early days by establishing a TBI registry, and where for 2 years we visited patients in their houses, first year, then second year, to see what happens to these people. Because the understanding is that if someone doesn't recover within 2 years after a brain injury, their chances of recovery are really remote. They need lifelong support and care. And to our understanding, about 20% of the people, they died after leaving the hospital, and nearly 30% of those who were discharged required care for either shorter duration or for longer duration in multiple areas. The area of neurorehabilitation or rehabilitation of brain injury survivors is in such a difficult one in this country. There was a study that came out very recently, a comparative study done between Harbourview Medical Center and All India Institute of Medical Sciences, New Delhi. They tracked patients who were discharged from the hospital to find out the outcomes. While about 2% of the people died in the US after leaving a hospital, 28% of the patients died after leaving AIIMS. And this is all published data. What it goes to show is that the field of bringing back these people back to life is something that, first of all, has not been clearly understood at a population level. In the hospitals, we may be able to see what happens to them and provide them support to the best possible extent. But please imagine the situation in rural areas, in district headquarters, in remote areas, tribal and hilly areas, where access is very limited, where healthcare is scant, in terms of what rehabilitation are they actually getting. The whole goal of injury and traumatic brain injury is to see that, first of all, TBIs does not occur. And that requires a wide range of activities to be done, which falls under the umbrella of prevention. And we need to do much more with regard to helmets, seat belts, child restraints, speeding, drink driving, cell phone usage, driver licensing, many other areas where there is a lot more work to be done. And in some of the areas, NIMHANS has initiated work and has been contributing in a really big way. After prevention, if at all the injuries, if it can be prevented, that is the best thing. If we can't prevent injuries, at least provide them the early best possible care to see that the complications and disabilities are reduced and survival rates increase. And that falls under the rubric of management which includes pre-hospital care, in-hospital care, and many other ambulance services, emergency care, bystander care, triage facilities, trauma coordinator, everything needs to be done. In fact, in Tamil Nadu, we did an evaluation of the trauma care services, and to our, much to our happiness, we found that there was a significant reduction in the number of deaths and long-term stay patients in hospitals in Tamil Nadu just because of one intervention. They appointed a trauma care coordinator and introduced systematic triage in all the hospitals to see that patients don't wait even for 5 minutes. And that resulted and provided the best possible returns. The third part of the spectrum is with regard to disability limitation and rehabilitation. And here again, people who are the survivors of brain injury, they require multiple care in multiple areas with multidisciplinary inputs. In fact, our own TBI registry data showed that there are physical problems, there are psychosocial problems, there are emotional problems, there are problems in language, in memory, in information processing, in communication. In multiple areas, they require these inputs. Especially when it comes to children, a lot of children, they miss their education. And they have problems for the whole of their life, not only because of the traumatic brain injury, but because of the limited rehabilitation facilities. So, even if an injury occurs and if a person gets hospitalized, it's important to see that they are brought back to their optimum quality of life by providing all the supportive facilities. And this requires multiple inputs. Professional involvement and engagement is very much essential. Policymakers need to be continuously engaged to come up with new activities and new programs and expansion of care and support, financing, coordination, and many others. We also need a greater engagement and involvement of the families. Most of the families after TBI thinks it is their fate. Nothing much can be done. And they resort to all other modes of management which would only worsen the situation, and sometimes it can lead to long-term problems. We now know that even mild brain injury, about 10 to 20% of them will have moderate to long-term difficulties in their life. And this rehabilitation is something which needs to be strengthened and promoted. And today, if you take, in every village, there is an ASHA worker, there is an Anganwadi worker, there is a village rehabilitation worker, and there is a teacher. And some of the simple skills can be taken to these people, at least in terms of what can be done for TBIs. The guidelines for management of neurotrauma is an excellent contribution in that direction, at least when it comes to management in hospitals. But it needs to get integrated in the healthcare system as a whole, rather than getting confined to academic institutions. And with this, the community-based support systems that are required, and it also requires input from multiple departments: Department of Economics, Department of Labor, Department of Transport, welfare, health, education. All these sectors need to come together to see that their care and their recovery takes place in the right earnest manner. It's not that we don't know what to do. We know what to do. There are enough examples at the global level, and even in the Indian level now, there are a few examples that have stood out and said that, yes, that we can do. For example, the 5 years of the Bengaluru road safety program that NIMHANS undertook in 2010 to 14 is considered as one of the good examples of how to do road safety programs. The World Bank supported Karnataka Integrated Health System project showed how to put trauma care in place in districts of Karnataka. The Ahmedabad experience of providing first care responders training is a very classical example of how this thing can be done. The Tamil Nadu example of Thai model shows that how triage and other things need to be done. There are many excellent rehabilitation centers across the country which are doing very important work when it comes to rehabilitation of the individual persons. And globally, there are many, many examples. Most of the times, what we say is that it is something not possible. France is a classical example where in 2003, they had 8,000 road deaths every year. In 2007, they brought it down to 3,000 deaths per year, which is such a significant phenomenal reduction. And they maintained at the same number and brought it down further to about 800, 900 deaths in recent days. We have examples from many countries of several things that need to be done when it comes to prevention, when it comes to management, and when it comes to disability limitation as well as in rehabilitation. But what should be leading us is data, and we should follow the science of what we need to do. What happens most of the times when there is a crash is that basically there is a crash, the driver runs away, public get around the place, someone sets fire to the bus, and people take their own decisions with regard to first aid. Someone takes them to some hospital, and then there is an investigation ordered, and there is an inquiry that is held, and then all is forgotten in 3 to 4 days. Only people who will not forget this are the person who experienced this event and their families who undergo very difficult times in several years to come in managing these patients. I think what needs to be done is a lot of work that needs to be done in the field of traumatic brain injury in terms of prevention, in terms of management and care, as well as in rehabilitation, and in bringing these systems and the governance mechanisms for its proper implementation. Thank you very much once again, and I'm sure NIMHANS would lead the way in the coming years to make much headway and progress in this area, to demonstrate to the country that we can do things in a very systematic and in a more organized way, as well as show the path for very effective policies and programs. Thank you very much once again.
So thank you, Professor Gurraj sir. Over four decades of the traumatic brain injury work, which translated into several policies at the state government and also at the central government level. On behalf of NIMHANS, on behalf of the organizers of this program, I take this opportunity to thank you profusely, and I request the director to hand over a small memento of our appreciation. Please. Thank you very much, sir. And I take this opportunity to thank over 3 decades of neurosurgical care and support, taking care of the traumatic brain injury patients at NIMHANS tirelessly by Dr. Indra Devi. And her services is always appreciated. As one of the appreciating thing is today what we witnessed is that Aniruddha could share so many of the patients who has got the surgical care and the supportive care by Dr. Indra Devi and her team is always appreciated. I request our director to hand over a small memento to her. I take this opportunity to thank our director for coordinating the whole program and also helping us to organize this, and also medical superintendent and the entire team of psychiatric social work department, and the okay. So our director has to leave for another program, and so we thank her. So I take this opportunity to thank the entire team of organizing committee, the Department of Social Work, Department of Clinical Psychology, and also more importantly, the neurosurgery team, the entire Department of Neurosurgery. Dr. Indra Devi, Dr. Dhaval Shukla is here, and the rest of the faculty of neurosurgery, and supporting team from the care and support which is provided by the nurses, which we always remember. And we have a dedicated team of neuroanesthesia team. And it's a teamwork. So when it comes to the traumatic brain injury and the management, it's a collective work. And all that collective work which translates into a better outcome at the end of the day for those individuals who have been affected by, it's kind of a polytrauma or traumatic brain injuries. As our chief guest clearly pointed out, and it's more important that we need to have a rehabilitative tools in place. One is a pre-hospital care and also inpatient care. Subsequently, they require long-term care. And the care which has to be comprehensive in nature under one roof, that will translate into a wonderful outcome for the traumatic brain injured patients. The entire team of NIMHANS, and I take this opportunity to thank each one of them for their contribution, including neurorehabilitation and other teams who contribute in terms of taking care of our patients. At the end of the day, the reward and the smile, what we get to see is that when the patient leaves our hospital by walking or with a smile. So on behalf of administration, on behalf of the institute, this is a wonderful program which is organized. This is the need of the hour. From last 3 days, we had 3 different programs. On Saturday, we had a program on World Head Injury Awareness Program. And various the clinical, psychological, and the psychosocial components. Yesterday was also deliberated with a lot of inputs from the patients. And today, we are discussing about the importance of psychosocial component as a teamwork, working together, how it is going to help the patient care at the end of the day. As the special innovative Dr. Indra Devi Madam has said, rehabilitation seems to be the key once the patient is discharged from our hospital. So we have a wonderful neurorehabilitation team. And thanks to all the faculty and the students. And more importantly, we have the students who have come from the Ambedkar Institute of Arts and Science from Chennai, all the way traveling and attending this program. I'm very sure that it is quite helpful for you. Garden City University of Bengaluru, and our own wonderful students, always bubbling and with a lot of energy from the College of Nursing. They always take part in all these activities. The entire team of the Psychiatric Social Work Department, PhDs, MPhil scholars, trainees, and the psychosocial support team, which is very strong at NIMHANS. All of your contribution is greatly appreciated. On behalf of each one of you, I thank the Department of Social Work Department headed by Dr. Dhanshekar Pandian. And also I take this opportunity to thank the coordinator of this program, Dr. Kanmani, and our entire young team who is here to take care of this one. So thank you very much. And so I'm very sure that these programs and these activities will continue. And please be in touch with the team of NIMHANS. So for various facilities and various activities and also various support teams, what we have. Thank you very much. Dhanyavad. Namaskar.
Thank you so much, sir. I thank each and everyone who have taken their time to come for this program, for making this program successful. I request everyone to please rise for National Anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you all. I request everyone to join the high tea.